Good morning, Dr. Eric here, Family Back Relief Center. Hopefully everyone had a great Memorial Day weekend. It's Tuesday, we're back in the office, and today we're discussing diabetic neuropathy management strategies. So peripheral neuropathy occurs when there's damage to the nerve cells. The motor nerve, sensory nerve information from the brain and the spinal cord to the rest of the body gets disrupted. And there's a variety of conditions that affect this, but the most common symptoms we see is changes to how you feel, the hands, the feet, weakness, numbness and tingling, pain. All these things occur as a result of when the nerves get damaged in the periphery. Now, some of the conditions that affect this are inherited genetic conditions, metabolic conditions, infections, traumatic injuries, exposure to toxins, but the most common cause is diabetes. So we're going to talk about that. Because left untreated, it can cause irreversible damage. So let's talk about some management strategies. Number one, vitamin D. Research has shown that diabetics, type 2 diabetics, are 3 times more likely to have a vitamin D deficiency. So make sure you're getting enough vitamin D. Enough depends upon the person, how clean your diet is, how nutrient dense your diet is, how much time you're spending outside in the sun, your age, any other conditions in the body. So if you want specific recommendations based on your particular condition or based on you, just shoot me a message, I'll give you a call and I'll give you a good starting point for vitamin D. B vitamins. Vitamin B deficiency, especially B1, 6, and 12, are a risk factor for nerve health. So we want to make sure that you're getting an adequate supply of B vitamins. Again, the amount is going to depend upon how good your diet is. But supplementation is always a good thing when you are diabetic and you are suffering with neuropathy symptoms. Avoiding gluten. Celiac disease, individuals with celiac disease, people are 2 to 2.5 times more likely to be diagnosed with neuropathy later in life compared to those without celiac disease. So avoiding the protein gluten, which is found in barley, rye, bread, all the wheat, a gluten-free diet can help to significant reductions in pain in the hands and the feet, some of the research points to. Sleep, getting good, restful sleep, making sure that you're doing the right night rituals to make sure that you're getting the proper amount of sleep at night, and that's consistent, not that you get 4 hours one night and then you get 6 hours and you get 8 hours and you get 3 hours. It has to be consistent and it has to be restful, non-disruptive. Avoid repetitive movements when possible. Repetitive motions of the hands and the feet can cause further inflammation in these joints, in these tendons, and the ligaments, and affect the nerves. So we want to avoid excessive movements whenever possible. Because things like carpal tunnel, entrapment syndromes, tarsal tunnel can occur with these repetitive movements that cause inflammation. The last thing is meditation. Mindful meditation is a practicing and focusing on one's awareness of their body, breath, or sensations, or whatever rises in each moment. A study found that participants who participated in mindful meditation for 12 weeks were less likely to need any pain medication. So there's a lot of good research pointing to mindful meditation as being a good conservative management strategy for people with diabetic neuropathy. Also, chiropractic. So I help patients with diabetic neuropathy ease their symptoms, regain some sensation back. Sometimes we can regain a lot of it back or all of it. Some of it's partial. Definitely help with joint movements, mobility, decreasing the inflammation through chiropractic adjustments and mobility movements and soft tissue work and some of the technology we use in the office. All this stuff is very helpful. It's usually never one approach. It's usually a handful approach. A concerted effort to help people manage diabetic neuropathy. If you have any questions about yourself or a family member or friend that is suffering with diabetic neuropathy and is looking for some help or be pointing in the right direction, please give us a call, shoot us a message. We are here and always happy to help you and point you in the right direction if we can't personally help you. Any questions, anything else on our website at familybackrelief.com, just shoot me a message. Hopefully everyone has a great day. It's going to be a hot one out there. Stay cool, and we'll talk to you next time.